Hello, good morning to all. Today I am going to take lecture on basic life support, which is useful for day-to-day life. I am Dr. V. SARADA Devi, Professor in the Department of Anesthesia, Mallareddy Medical College for Women. Before going to lecture, just I would like to show one video. Another thing is, at the end of the session, the learner should be able to describe the steps in basic life support and other things, and able to know and describe the importance of basic life support.
What to do when you see someone collapse to the ground. Ensure that the scene is safe. Tap the shoulder of the victim and check the response. If there is no response and no breathing, call for help. Activate the local emergency medical system and ambulance. Then, start chest compressions. Keep the heel of one hand on the center of chest. Place the other hand over it, interlocking the fingers. Keep the elbow straight, shoulder above the chest. Push hard, 5 to 6 centimeters downwards. At a rate of 120 per minute. Allow the chest to recoil after each compression. Count back 1, 2, 3 until done. After 5 such cycles, check response again. Do not interrupt chest compressions unnecessarily. Continue compressions until the victim becomes responsive for higher measures. Do not hesitate. Reaction is considered valid.
So, after seeing this video, you will come to know how to start the basic life support. So, regarding cardiopulmonary resuscitation, there are two steps. One is basic life support, other one is advanced cardiac life support. Today I am going to cover only by basic life support. So, basic life support is a life support without the use of special equipment. What about this advanced cardiac life support? It is a life support with the use of special equipment like airway, endotracheal tubes and defibrillator. And research continues to improve how we respond with life-saving techniques to emergencies. So these techniques are based on the most current research, and they are organized into a systematic response called the chain of survival, which begins with basic life support. The chain of survival provides the victim the best chance to receive the care needed and return to a healthy life. So basic life support is a level of medical care which is used for patients with life-threatening illnesses or injuries until they can be given full medical care by advanced life support providers. Basically, it is doing out of the hospital cardiac arrest cases. So BLS improves a person's chance of surviving until advanced care becomes available. So CPR is as easy as to remember as CAB. C meant for compressions, A meant for airway, B is for breathing. So compressions, you have to push hard and fast on the center of the victim's chest. Whereas airway, you have to open the airway, tilt the victim's head and back and tilt the chin to open the airway. Breathing, you give mouth to mouth to rescue breaths. This is American Heart Association emblem. So in this you have to, they say that learn CPR and save the lives. So in CAB, compressions and airway and breathing in detail, how will you give chest compression? The human brain cannot survive more than 3 minutes with lack of circulation. So chest compressions must be started immediately for any patient with absent cerebral pulsations. Airway in unconscious patient, it results in airway obstruction because of tongue fall. So you have to open the airway and open the airway by tilting the head and chin lifting. Whereas in breathing, with the airway open, using the head tilt and chin lift maneuvers, you have to pinch the nostrils shut for mouth to mouth breathing and cover the person's mouth with your he was making a seal. So previously it was ABC pattern. So up to 2010, from 2010 onwards it changed from ABC to CAB. So you have to press on CAB. So initially it was mainly concentrating on airway, breathing and circulation. Now it is CAB is circulation, airway and breathing. So circulation is by giving chest compressions, and you have to open the airway and you have to give rescue breaths. So what is the chain of survival? Early initiation of basic life support has been shown to increase the probability of survival for a person experiencing cardiac arrest. To increase the odds of surviving a cardiac event, the rescuer should follow the steps in the chain of survival. So first you have to activate the emergency response by calling 108, or you have to activate the code blue. Once you are in the hospital, you have to activate the code blue. Then perform early CPR, and after that you have to defibrillate with AED if it is available. Then once person reached the hospital, you have to start the advanced life support. Even in ambulances also you will get all the equipment so that you can start advanced life support as early as possible. So after post cardiac arrest care, you have to take care after the post cardiac arrest. Then to the recovery. This is the chain of survival. What are the keys for basic life support? You have to start the chain of survival as early as possible. So that means quickly start the chain of survival. Deliver high quality chest compressions to circulate oxygen to the brain and vital organs. Know when and how to use automated external defibrillator. Provide rescue breathing, and understand how to work with other rescuers as part of a team. What is the aim of giving basic life support? Aim or purpose? To maintain the blood circulation by external cardiac compressions, and to maintain an open and clear airway, and to maintain breathing by artificial ventilation, to restore cardiopulmonary functioning, and to prevent irreversible brain damage from hypoxia. So time is very important. As early as possible you have to start giving chest compressions and clear the airway, and by giving rescue breaths. And to save the life of the patient, to provide basic life support till medical support arrives. So what are the indications for basic life support or cardiopulmonary resuscitation? Once person is in cardiac arrest or respiratory arrest, so you have to start giving basic life support. So what are the indications? Cardiac arrest is due to either by ventricular fibrillation or ventricular tachycardia or asystole or pulseless electrical activity. Whereas respiratory arrest is due to drowning, stroke, foreign body in throat, smoke inhalation, drug overdose, poisoning, suffocation, accident, injury and coma. How will you diagnose whether person is in cardiac arrest or not? So you have to assess loss of consciousness or unresponsiveness. That means person is not moving and not breathing. Then loss of apical or central pulsations like carotid or femoral pulsations. Absence of respiratory effort. Then generalized pallor and pupillary dilatation. So what are the causes of cardiac arrest? Easy to remember, there are 6 H and 4 T's. One is hypoxia, then hypotension, hypothermia, hypoglycemia, acidosis, hypokalemia, electrolyte imbalance, or cardiac tamponade, tension pneumothorax, thromboembolism either pulmonary or coronary, and toxicity with digoxin, local anesthetics or insecticides. So what is CPR? Cardiopulmonary resuscitation is an emergency procedure that is a combination of chest compressions with artificial ventilation in an effort to manually preserve the intact brain function until further measures are taken to restore spontaneous blood circulation and breathing in a person who is in cardiac arrest. So what is the criteria for giving high quality CPR? Start chest compressions hard and fast within 10 seconds. Allow for complete chest recoil between compressions. Minimize the interruptions between chest compressions. Assure that the breath makes the chest rise. So do not overventilate. Assess for shockable rhythm as soon as AED available in witnessed cardiac arrest, as it is most likely a shockable rhythm. So as soon as you reach the spot, you have to verify whether the scene is safe or not. So you have to verify scene safety. Then if person is unresponsive without normal respirations, you call for help. You call 108 ambulance or activate the emergency medical system and get an AED. And assess the pulse. Definite pulse within 5 to 10 seconds. Then start if there is no normal breathing and no pulse, administer one breath every 5 to seconds and assess pulse every 2 minutes. If normal breathing and pulse felt, monitor till emergency responder arrives. Then if there is no pulse, then start CPR. Start cycles of 30 compressions and 2 breaths. And if AED or defibrillator arrives, assess for shockable rhythm. If shockable rhythm is there, then administer one shock and resume CPR immediately for 2 minutes. If there is no, if it is not shockable, then resume CPR immediately for 2 minutes and assess rhythm every 2 minutes and continue steps until advanced cardiac life support provider arrives or until the person shows signs of return of circulation. So what is one rescuer basic life support and CPR for adults? So steps are: be safe and assess the person and call for emergency medical system, call for help otherwise, and cardiopulmonary resuscitation and then defibrillate. So as soon as you reach the spot, you make sure that scene is safe before proceeding and move the person out of the traffic and move the person out of water and dry the person. In drowning, persons should be removed from the water and dried up, and they should also be removed from standing water such as puddles, pools and gutters. And be sure that you do not become injured yourself. So early recognition is more important in the chain of survival. So assessment is of crucial importance. Check if the victim is responding or not by shaking shoulders gently and by asking, are you all right or not? Or breathing or pulse at the same time. And call emergency medical system 108 and send someone for help or to call emergency number and to get an AED. If you are alone, call for help while assessing for breathing and pulse and call for help without leaving the person. And start CPR. Begin sets of compressions and rescue breaths and then defibrillate once you get the AED. Attach the AED pads when available. So what are the CPR steps? Check for the carotid pulse on the side of the neck and keep in mind not to waste time trying to feel for a pulse. Feel for not more than 10 seconds. If you are not sure you feel a pulse, begin CPR with a cycle of 30 chest compressions and 2 breaths. Chest compressions process. How will you give chest compressions? Interlock both the hands by placing one hand over the other and place the interlocked hands on the sternum. Shoulders should be positioned directly over the hands with the elbows held straight and arms extended. Use your upper body weight to compress. Sternum must be depressed at least 5 centimeters in adults and 2 to 4 centimeters in children and 1 to 2 centimeters in infants. So push hard and push fast must be performed at a rate of 100 to 120 per minute. During CPR, the ratio of chest compressions to ventilation should be as follows. So if you are a single rescuer, 30:2. In the presence of 2 rescuers, chest compressions must not be interrupted for ventilation. Use the heel of one hand on the lower half of the sternum in the middle of the chest. Put your other hand on the top of the first hand. Straighten your arms and press straight down. Compression should be at least 2 to 2.4 inches, that is 5 to 6 centimeters in the person's chest, and at a rate of 100 to 120 compressions per minute. Be sure that between each compression you completely stop pressing on the chest and allow the chest wall to return to its natural position. Leaning or resting on the chest between compressions can keep the heart from refilling in between each compression and make CPR less effective. So shoulders should be positioned directly over the hands with the elbows held straight and arms extended. So use your upper body weight to compress. So push hard and push fast. It must be performed at a rate of 100 to 120 per minute. Single rescuer 30:2. In the presence of 2 rescuers, chest compressions must not be interrupted for ventilation. So this is how to open the airway. Head tilt and chin lift. Okay, and other one is this one is jaw thrust. If you are suspecting any cervical injuries or any spine injuries, you should not do these 2 procedures, and that's just you have to do the jaw thrust. Airway patency. So by seeing this is the diagram showing how to clear the airway. This is the in unconscious patient, because of tongue fall, there may be airway will be blocked. So you have to tilt the head and lift the chin, so that you can open the airway. Whereas in cases of spine injuries, you should not do these 2 procedures, and you have to do the jaw thrust. So how will you do jaw thrust? You have to place the fingers posterior to the mandible of jaw and apply upward and forward pressure. So hold mouth open slightly using the thumbs. So after 30 compressions, stop compressions and open the airway by tilting the head and lifting the chin. Put your hand on the person's forehead and tilt the head back. So lift the person's jaw by placing your index and middle fingers on the lower jaw and lift up. Do not perform the head tilt and chin lift maneuver if you suspect the person may have neck injury. In that case, jaw thrust is used. For the jaw thrust maneuvers, grasp the angles of the lower jaw and lift it with both the hands, one on each side, moving the jaw forward if the other's lips are closed. Open the lower lip using your thumb. So give a breath while watching the chest rise. Repeat while giving a second breath. Breaths should be delivered over 1 second. So resume chest compressions. Switch quickly between compressions and rescue breaths to minimize the interruptions in chest compressions. So after that, breathing. How will you give rescue breaths? The one method is mouth to mouth breathing. With the airway held open, pinch the nostrils closed, take a deep breath and seal your lips over the patient's mouth. Blow steadily into the patient's mouth, watching the chest rise as if the patient was taking a deep breath. So if 2 rescuers are available for BLS, many times there will be a second person available that can act as a rescuer. Direct the second rescuer to call 108 or emergency medical service system without leaving the person while you begin CPR. When the second rescuer returns, the CPR task can be shared. The second rescuer prepares the AED for use. You begin chest compressions and count the compressions out loud. The second rescuer applies the AED pads. The second rescuer opens the person's airway and gives 2 rescue breaths. Switch roles after every 5 seconds of compressions and breaths. One cycle consists of 30 compressions and 2 breaths. Rescuers who become tired may tend to lean on the chest more during compressions. Switching roles helps rescuers perform high quality compressions. So quickly switch between roles to minimize interruptions in delivering the chest compressions. When the AED is connected, minimize the interruptions of CPR by switching rescuers while the AED analyzes the heart rhythm. If a shock is indicated, minimize interruptions and resume CPR as soon as possible. What is AED? This is an automated external defibrillator. It is available everywhere in airport, shopping malls, etc. in the first aid equipment. The AED in combination with the effective CPR is a critical part of AHS chain of survival. AED analyzes the heart rhythm of the patient automatically and accordingly triggers the shock. These are available in public places like airport, shopping malls, etc. in the first aid equipment. How will you position these paddles of the AED? One paddle is placed in the right intraclavicular region, while the other is placed in the left 5th to 6th intercostal space in the anterior axillary line. So, applying of AED, automated external defibrillator steps. So, retrieve the AED, open the case and turn on the AED. Expose the person's chest. If person's chest is wet, then dry the chest, remove the medication patches, then open the AED pads, peel off backing, check for pacemaker or internal defibrillator, and apply the pads. Apply one pad on the upper right chest above the breast, apply the second pad on lower left chest below the armpit. So ensure the wires are attached to the AED box. Move away from the person. Stop CPR, clear the person to make sure no one is touching any part of the victim. So by seeing this, how to attach the pads, you just see in the diagram. Analyzing the rhythm. Do not touch the victim. Shock indicated. Stand clear and deliver the shock. So delivering the shock using AED, defibrillating the patient person. Shock delivered. Follow AED instructions. So after that you have to start giving compressions again and assess the rhythm and start giving chest compression, 30 compressions and again 2 rescue breaths. If victim starts to breathe normally, place him in recovery position. So these are the defibrillatory safety. The 5-point check is patient should not have pacemaker. You have to check for pacemaker, piercing or tattoos, perspiration or wet skin, pendants or other pieces of jewelry, medication patches like GTN or HRT or pain medication, and the AED, whether it is in good working order or not, you have to check. And do not use the AED in heavy rain. Do not use if they lay in a pool of water. Do not use in an explosive environment. This is a pediatric BLS algorithm. So, criteria for high quality CPR. Rate is again at least 100 to 120 compressions per minute. Compression depth to be 1/3 depth of the chest. Full chest recoil between the compressions. Minimal interruptions during chest compressions and do not overventilate. Unresponsive without normal respirations, call for help 108 or activate the emergency medical system and get AED or defibrillator. Assess the pulse. And if there is a weak pulse, administer one breath every 3 seconds. Add compressions if pulse remains less than 60 per minute with poor perfusion despite adequate oxygenation and ventilation. Assess pulse every 2 minutes. If you are one rescuer, begin cycles of 30 compressions and 2 breaths. 2 rescuers begin cycles of 15 compressions and 2 breaths. If AED arrives, assess for shockable rhythm. If it is shockable rhythm, then administer one shock and resume CPR immediately for 2 minutes. If AED message does not read the shock, then resume CPR immediately for 2 minutes. Assess rhythm every 2 minutes. Continue steps with ACLS providers arrive or until the person shows signs of return of circulation. So CPR in infants. Infant chest compressions, infant 0 to 12 months can be done in 2 ways. Place 2 fingers in the center of the chest or place 2 opposing thumb fingers. This is the center of the chest. And opposing thumb fingers. One rescuer chest compressions must be continued for 2 minutes before reassessment of cardiac rhythm. 30 chest compressions followed by 2 rescue breaths and breath every 6 seconds, 10 to 12 per minute. If 2 rescuers are available, chest compressions must be 15 followed by 2 rescue breaths. Breathe every 3 seconds, 20 to 30 per minute. What are the complications of cardiopulmonary resuscitation? While giving chest compressions, sometimes there may be chances of skeletal injuries, especially rib fractures, and visceral injuries, myocardial and pulmonary contusions, blood in pericardial sac, pneumothorax, liver and spleen rupture, and gastric perforations. And while doing intubations and all, airway injuries, tracheal or laryngeal injuries, skin and integument damage. So post-resuscitation care is most important. Once patient is recovered, you have to maintain the airway and breathing, check for circulation. If there is any disability, optimizing the neurological recovery, sedation if required, and control of seizures, temperature control, and treatment of hyperpyrexia, and treatment of hypothermia, and monitor the blood glucose levels. So summary of steps. CPR sequence, CAB, chest compressions, airway and breathing. At least 100 per minute, 100 to 120 per minute. Compression depth at least 2 inches, 5 centimeters. Chest wall recoil, allow complete recoil between compressions. Rotate compressors every 2 minutes. Compression interruptions, minimize the interruptions in chest compressions. So attempt to limit interruptions to less than 10 seconds. Airway clearance, head tilt, chin lift, suspected trauma, jaw thrust. Compression to ventilation ratio is 30:2 until advanced airway is placed. Ventilation with advanced airway, 1 breath every 6 to 8 seconds, that means 8 to 10 breaths per minute. Asynchronous with chest compressions. About 1 second per breath, visible chest raise should be there. So defibrillation, minimize interruptions in chest compressions before and after shock, and resume CPR beginning with compressions immediately after each shock. So conclusion is, by learning the cardiopulmonary resuscitation, especially basic life support, every citizen become a lifesaver. So by learning this, every citizen is a lifesaver. So you learn CPR and save lives. Thank you. For your understanding, I will recap the video again.
What to do when you see someone collapse to the ground. Ensure that the scene is safe. Tap the shoulder of the victim and check the response. If there is no response and no breathing, call for help. Activate the local emergency medical system and ambulance. Then, start chest compressions. Keep the heel of one hand on the center of chest. Place the upper hand on it, interlocking the fingers. Keep the elbow straight, shoulder over chest. Push back